People question about the benefits of niacinamide all the time. Niacinamide has been used in dermatology years ago for many different things. In some type of older studies, they were used for more serious conditions, blistering, rashes, and autoimmune conditions. And what niacinamide does when you eat it and take it in combination with some other medications is it decreases the overall inflammation on your skin, and therefore it can help some inflammatory disorders. And so studies like that sort of got some steam, and then they kind of move forward to treat more common conditions with the niacinamide. And one of those conditions is acne. Treatment for acne with niacinamide came about probably about 20 years ago, where there was an indication of using niacinamide twice a day for acne patients, and it does work well in patients that have inflammatory acne. That's the acne where you start getting red pimples and you have pustules or a little pus in your pimples, and it can decrease the inflammation on the skin that causes that acne. And the last thing we start seeing niacinamide being used for is for DNA repair in damaged skin for cosmetics. And some people believe if you either eat the niacinamide or you place it on your skin, some studies are showing that that has some benefits in repairing DNA and therefore sort of reversing the signs of aging. I personally don't use niacinamide because I haven't seen great results in patients that have these autoimmune blistering diseases to decrease the inflammation, and I really haven't seen great results in my acne patients. I kind of use it as my last step when you're running out of things to do, to use it as one of your last steps to treat patients. If you want to learn more about these topics, you can visit our website at cinedern.com and make an appointment with one of our providers, or you can call to make an appointment at 718-491-5800.